So again, allow me to introduce myself. My name is Rosa Andrews. I'm the Communications and Outreach Director here at NAMI Miami-Dade. I'm lucky enough to be able to do this as the experts and have amazing experts like tonight join us and help us educate ourselves and our community in different topics, different mental health conditions and diagnose and other things that help us be there for each other in a way that it's, not judgmental without, the stigma and learning, right, about all the different conditions and symptoms and treatments and all this very important information. So I want to make sure that so we can keep this on the time frame that we have. I'm going to allow, after my introduction, Dr. Buxani to do her presentation. The chat is always open, so please feel free to ask any questions while we're going through the presentation, or I'll ask you to mute yourself. And then at the end, there's going to be a couple minutes so you can unmute yourself and share and ask any question that you may have. So with that, we are very excited. And I want to make, also I want to share, some of the people here know who we are, but I'll share this again. We're NAMI. We're the National Alliance on Mental Illness. We are the largest peer-led mental health organization in the United States. And we're the affiliate here in Miami-Dade. And we also serve Monroe County. We have many free programs. We have free support groups for peers with a mental health condition or a mental health struggle, and for family members, caregivers, and loved ones. We have educational programs for peers and family members. We have a helpline. We have a suicide awareness prevention training, and we have a Ending the Silence, which is our program for youth, families, and staff that works with children, among other staff as well. So we have a lot of programs, and I'll make sure through the chat at the end, I will share our website, some of our upcoming events. We do have a QPR coming up tomorrow that you can join, and everything we do is completely free. So I just want to make sure that you guys have all that information and that you're always free to reach out. I'll put my email as well as our website and our helpline too at the end of this speaker meeting. So I'm going to make an introduction of our expert tonight. I'm extremely excited to have her here and for her to take her time to join us and to help us educate our community. So tonight we have Dr. Rachna Buxani-Mirpuri, and I practice the name and last name. Thank you. She's a licensed mental health counselor practicing in Florida and the founder of Buxani Counseling Care. She also has an established career as a counselor in Dubai and the Cayman Islands, and continues to help international clients via HIPAA-regulated video conferencing as a board-certified telemental health provider. She has practiced as a counselor for almost 20 years, nationally and internationally, in government, private practice, and school settings. Her approach to helping provides an empathetic, non-judgmental, and safe environment for clients to heal and become resilient through the therapeutic process. This resilience-based, client-centered approach to therapy allows her to empower clients to reclaim the inherent strength that lies within them. She aims to provide affordable quality mental health support so that no individual or family suffers due to lack of access to such help. Prior to her work as a licensed mental health counselor, Dr. Buxani-Mirpuri served as a counseling coordinator for 21 schools in the United Arab Emirates. Through her experiences, she has developed a keen awareness and understanding of the needs of young clients and their families. Specifically, she has extensive experience working with both teens and adults to overcome various challenges, including depression, anxiety, eating disorders, general life stresses, behavioral disturbances, interpersonal conflicts, and marital and family dysfunction. Dr. Buxani's greatest strength when delivering intervention is her multicultural counseling experience. She's especially empathic to cultural dynamics in the context of mental health issues amongst clients. Through close collaboration with the client, she supports them in the process of change and aids with improving their overall satisfaction with life. Additionally, her dialectical behavioral therapy certification has resulted in her keen ability to teach mindfulness, relaxation, and distress tolerance techniques that provide her clients with the skills necessary to navigate challenging life events. Dr. Buxani is an active member of the American Counseling Association, American Psychological Association, and the American Mental Health Counseling Association. So we want to thank you again. Thank you, Dr. Buxani, for being here. We really appreciate it. I know how busy you are and that you're taking your time to give back to our community and to be able to talk about this very important topic and to share your knowledge and to educate our community. So with that, I'm going to let you take it away. If you want to share your screen.
Thank you. That was too much, Rosa. I need to shorten the bio when I said it. So, but I do appreciate it. I'm actually then going to skip through one of my slides that I have because I have that too. All right, so we're going to talk about borderline personality. And the reason I chose this is because I was talking to Rosa before we started. And I said, Rosa, you know, as I have worked in the field of mental health, I've realized there are many more people struggling with personality disorders than we know, or that we understand. And I think an understanding of personality disorders is very important, not only for the person maybe struggling with it, but also for people who might be living with people who struggle with personality disorders. And you're thinking, okay, something's not working over here. What is it, right? I'm not able to pinpoint it. A lot of patients who come in and who present with depression and anxiety end up having personality disorders. And that's really where I started getting extremely interested in it, studying it more, and also obviously trying to help my clients through it. So that's little friendly reminders, which I think Rosa has been through it, so we're good. And I'm going to skip through this because I don't think we need to hear anything more about me other than Buxani Counseling Care is, we just moved into a really nice, bigger space and it's close to Dayland. But we have obviously a website, buxanicare.com. I'm very active on social media only for mental health purposes. So there's a lot of stuff that we put out. So please feel free to follow us, Facebook, Instagram, Buxani Care. You know, lots of good information over there. But I'm going to skip through this because she said enough. All right. Okay. So let's get into the meat of what we're here to talk about today. What are personality disorders? So it's really, you know, that maladaptive behavior, but what it ends up affecting the most is our relationships, right? It's a maladaptive way of relating to others. And it really has to be, it can't be that, okay, I'm like that at work, but at home I'm getting along with everyone really well. So it really has to go across all our different situations. So it needs to be reflected in work. It needs to be reflected in our social situations. It needs to be reflected in our personal relationships. And I think what's key about the cluster B, and we'll talk about the cluster B, and so personality disorders in the DSM, again, our guiding light, are broken down into 3 clusters, A, B, and C. We find the cluster B being some of the most challenging, only because there is a lot of misinformation surrounding it. There's a lot of stigma surrounding it, but there's also a lack of understanding about it. It's not very clear-cut, right? So when a person walks in, I would not be able to diagnose a person in the first go or the first session, second session to say, oh, you have borderline. No, it really does take time because it kind of comes through in the interactions that our clients are having with us, in addition to what we're hearing about their interactions with other people. And what it affects the most is your sense of self. I will explain that in more detail, right, when we get into borderline and what that identity crisis sort of is. But when we talk about cluster B, it's the clients that we see who struggle with cluster B, which is borderline personality, antisocial personality disorder, narcissistic, and histrionic. These are the 4 that make up the cluster B in the DSM. And really what we see is an extreme emotional dysregulation. I have clients who in a 50-minute session can go from crying to happy to really agitated to then curling up in a fetal position. I will see it all in that 50-minute, right? So they really have a difficult time regulating emotions. They can be combative in their interpersonal relationships. They can be dramatic. So when we have clients like that, that's what makes it sometimes challenging, or why they're labeled as challenging, right? Which I don't consider them to be. But that's why, again, some myths or some misinformation, that's why, they're considered, oh my gosh, this is a person who has too much chaos and drama. So because they present that way. What are the causes for personality disorders? It's always nature and nurture, right? Like every mental illness is a combination of obviously genetics. And then in this case, it's really abuse and an invalidating early environment. So if a client comes from a family that they have maybe not been abused, but really just the put down, so emotional and verbal abuse, or just neglect, that your needs you're invisible. As a parent, I'm not even paying attention to you. I have too much of my stuff going on and I'm not taking care of you. At that point, a child kind of has a difficult time understanding how to soothe and also understanding what their role is within the family and then subsequently within society. And so they have identity crisis. And that's what some of the causes of personality disorders are. All right, so what's borderline? We're going to talk about the 9 traits that the DSM talks about. But if I had to really concise it for you guys, it is this, right? It's an instability of mood, behavior, relationships, and sense of self. And the hallmark is that instability, that I don't feel, I don't know who I am, right? And this presents in various forms. And when we talk about the traits of borderline personality, you'll see how this sense of self really comes out and comes across. But it's that extreme instability of mood, which causes the behavior, right? Because if I am extremely anxious, I mean, I have clients, some young clients who are in their 20s, who are diagnosed with borderline. And, if they get triggered for some reason, they have such a difficult time controlling that level of anxiety and thus then reacting to it, which is where that behavior comes from. Borderline personality really stems from a deep fear of abandonment. And we're going to talk about that and why somebody might feel abandoned, because this is also very confusing, because I've had clients who, eventually have diagnosed as borderline and they say, okay, but my parents never left me, they never like physically abandoned. And it doesn't have to be, it could be an emotional abandonment, right? Because if I'm being hit by my father, if I'm being abused by my parent, whether that's mom or dad, I'm emotionally abandoned, because we don't expect our caretakers to do that, right? So that abandonment is really, really deep ingrained in people with borderline personality. And of course, the impulsivity of behavior and emotions. And I will give you all tons of examples. to clarify. But please, as we go along, and I was telling Rosa, let's have a dialogue. And she said, no, Dr. Buxani, we cannot do that, because then there will be, we'll have chaos and noise from everywhere. But please keep asking questions, because she will ask me, of course, we will do the question answer later. But if there's something that you want, you're urging to ask me while we're doing this, please just put it on the chat and Rosa can ask me. All right, statistics. We love statistics in psychology. And here's the thing, it's very hard, because we have 1.6% of the population that's been diagnosed with BPD. But honestly, most of us know that it's more than that, somewhere between 3 and 5%. We don't know, because a lot of clients don't report, because again, they don't have an understanding. And there's not a lot of really good measurements that we have of personality disorders. Having said that, 75% of those diagnosed tend to be women. That doesn't mean men don't have BPD, because I have clients who are men who have BPD, but majority of them tend to be women. Or maybe they're just the ones who are seeking out help. Who knows, right? But that's what we see in therapy a lot. Okay, now this is something that's actually not in the DSM. So the DSM identifies those 9 traits, which, like I said, we will go through. But there's been a lot of research, and there have been people who've researched, and one amongst them is Theodore Millon. And he, in fact, founded the Journal of Personality Disorders. He's, established the Society for Study of Personality Disorders. So he's done a lot of work. He did a lot of work. He's no longer alive, but he did a lot of work with personality disorders. And he came up with these 4 types of borderline personality disorders, only as a way of understanding it better, right? So let's talk about those. So the first one is the quiet discouraged. This person is, so if a quiet discouraged borderline gets triggered, what they do is they tend to internalize it. They are the high functioning ones, right? The perfectionists. Oh my gosh, I can't go wrong, because if somebody says something, or if I do something that's like a mistake, I cannot forgive myself. Oh my gosh, I'm going to spend the whole night ruminating about, why did I say this thing to this person in this, social gathering? Oh my gosh, this person is going to hate me. They're going to, so they really, tend to internalize and really cannot tolerate making even small mistakes, right? Also, their identity is linked to other people to a great extent. So how other people view them is extremely important to them. So that's why these mistakes are very, very detrimental to themselves, because it's like, oh my gosh, this person's going to hate me. What are they going to think about me? And I can see, well, the ones who have their cameras on, I can see people nodding, because we know people like that, right? Like the ones who are, oh my gosh, let it go. Nobody cares. Nobody's thinking about you, but they're like, no, I can't forgive myself for this. So that's the quiet and discouraged subtype of BPD. The next one is impulsive, and impulsive really shares some traits with antisocial. So this subtype of borderline personality really does not, so they have those uncontrolled rage and really, as we call the wrath, but they also lack empathy. So, and that's where it shares characteristics with your antisocial personality disorder, because it's that lack of empathy. And in that process, because of that lack of empathy, they can harm, or that lack of self-reflection, they can harm themselves, but they can also harm others. And they won't take that time to reflect. The petulant borderline, that's think about passive aggressive, stubborn, socially immature. right? Attention-seeking person. It's and I see in my practice, I see a lot of the I see the quiet discouraged, but I see a lot of the petulant borderlines, because they really tend to get extremely depressed. They feel worthless as adults because as children, their needs have never been met. So they grow up to be extremely sensitive to their relationships. They also display rage, but really it comes from that sadness, a really deep sadness, because it's like, hey, pay attention to me, pay attention to me. Why aren't you paying attention to me? And because of that, because of their neediness, sometimes they can come across as being socially immature, or they are the ones who will be, oh, really? You're going to leave me? Wait, I'm going to leave you first. I'm not even going to give you a chance. Watch me walk out that door, right? So think about, the person who's again, fear of abandonment, but also passive aggressive, that, okay, I want nothing to do with you. Today you've upset me. I'm going to cut you off right now. Right? So that's your petulant borderline. And the last one is the self-destructive. And like the quiet discouraged, they tend to, turn inwards, causing a lot of conflict, a lot of pain within themselves, tend to give a lot in relationships, but with an expectation. So they get very angry if they don't get it in return, right? So sure, I'll give you this, and I'll do this, and I'll do that for you, because I identify through my relationships. But now if you don't do that in return, that's going to upset me. And then those are the ones who will, have suicidal attempts, who will engage in self-harm, because it's so distressing for them when they don't get what they feel they should be in relationships. All right, so now we're going to discuss the traits of borderline personality, and these are from the DSM. Okay, so let's talk about each one of this, right? So we talked about abandonment, and I think the key to understand with abandonment is it could be real or perceived, right? Oftentimes, in my view, people with borderline personality, they have their perception of what is happening is a little skewed, right? So if a partner is walking away because they need, so say I'm having a fight, I have borderline, I'm in an argument with my husband. He's walking away because he needs space, because he's feeling flooded, he's feeling overwhelmed. But to me, that you're abandoning me, right? So it's not a real abandonment, because he's not actually walking away from me. He's just walking away because he needs that time and space. But for me, that feels like he's abandoning me. So oftentimes it's that perceived sense of abandonment, or that, that fear that it's like, oh my gosh, you're going to leave me, you're going to leave me. And it's a very, very real and intense fear for those who have BPD. A pattern of unstable relationships, that makes sense, right? Because from everything that we've talked about, from the types of borderline to just what I've even discussed with you here, that extreme dysregulation of moods can be very intimidating for partners. So, they often experience relationship after relationship after relationship, and that instability of relationships. The identity disturbance, and this is where I said I would come back to it, because we see people with BPD, so they're the ones who are changing their hair color. All of a sudden, they are wearing contact lenses with different colors. They don't know who they are. They're trying to figure it out. And in that process of trying to figure it out, they constantly tend to work with their identity. Impulsive. So last week, one of my clients with borderline, she got into a fight with her boyfriend, walked out of the car, started walking in the middle of the road. It was dark. She was alone. Not a very smart thing to do. But again, that pain, that anxiety that they feel is so intense that really they're trying to cope with it. And to be able to cope with it, they sometimes engage in very risky behavior. Now, that's when I'm triggered. But sometimes borderlines will also engage in risky behaviors just because they want to be accepted. They want to, so we see people with BPD have substance abuse issues sometimes. So things that obviously are not good for them, but again, everything as a means of, I don't know who I am. I'm trying to figure this out. I'm trying to deal with this intense pain. And this is a way of numbing myself. So they will engage in risky behavior. They have a high rate of suicide attempts, especially the self-destructive ones from Dr. Milan. So because they're so hard on themselves and it's so hard for them to understand why somebody would not reciprocate in kind what they're doing, they will tend to harm themselves. And like it says, so that they don't feel that abandonment, right? And it could be a perceived abandonment. Remember, we spoke about that, but it's just dealing with the pain. They have frequent mood swings. I think we should take a minute to talk about this because one of the things, and this, it drives me absolutely crazy because there are so many people with borderline personality who are actually diagnosed with bipolar, who are then getting medicated for bipolar disorder. And really, that's not what's going on, right? So first of all, bipolar is not a personality disorder. It's a mood disorder. It comes in a whole different section of the DSM. Why those two get confused sometimes is because of this. Because we see frequent mood swings of that, okay, I'm happy, but then I'm irritable, and then I'm angry, and I'm sad. People, and sometimes even clinicians, tend to misdiagnose people with having bipolar. What is the difference? One key difference. A person with bipolar is not going to show the mood swings in one day. So a person with borderline will have these mood swings, but in the same hour, in the same day, in the same few hours, right? With bipolar, it's very set. You're going to have those episodes of mania, which could be irritability, anxiety, anger, but it's going to last for at least a week. You're not going to see it fluctuate in a day like how we see it in borderlines. So that's really the biggest difference between borderline and bipolar. Feelings of emptiness. I often tell my clients that it's really that they have a hole, but it seems like that hole never gets filled, right? Because it's a hole. So everything that anybody is putting in just goes right through. Until they learn that, to love themselves, to understand themselves, right? And when we talk about treatment, we'll touch upon this a little bit more because I have my thoughts about that. But it's really that extreme feeling of emptiness that and loneliness. I'm alone. I have nobody. Nobody understands me, right? Of course, they have a difficult time managing emotions. Spoken about that. But I think the most important thing to understand there is the people around them, right? Because we'll often hear partners saying, oh my gosh, but I have to walk on eggshells around her because I don't know, at any point she's just going to blow up or he's just going to blow up. And I don't know if, I'm going to say something and it's going to cause chaos. So they tend to walk on eggshells, and it's very disruptive for a relationship, right? Another very important thing, I think, to understand over here about borderlines is the swinging from idealization to devaluing. Okay, so patient example again. I have lots of them. So even when you have questions, if I can bring in examples to help you understand better, I will try to do that. So I have a client who has a borderline personality. I actually see the family because it's stressful. And recently I started seeing the daughter's boyfriend also. This patient of mine has two daughters, so two girls. And this is the younger daughter's boyfriend who, because I guess my patient tended to see this boy as the son she never had. So up he goes on the pedestal. And while I was talking to him, because it's a difficult family situation. So like I said, I work with the whole family. But I explained this concept to him. I said, listen, you're on the pedestal right now. You're just going to do one thing, and then you're going to be down on the floor. So just know that, so that you don't feel any which way, right? So people with borderline personality do that a lot. They will put somebody on a pedestal, and if they get triggered, or if it's not going their way, or if they're not getting in return what they think they deserve or need, they will take the person and throw them right down on the floor, and then you don't exist for them, right? Or they're mean, they're angry, irritable, agitated. So it's important to understand those concepts again if you are living with somebody who has borderline. And under extreme distress, which in most cases, we know that about depression, we know that about most of the mental illnesses, if it's extremely distressing, we do see people with borderline disassociate and show psychotic symptoms. I haven't come across personally many of those, but yes, it could happen if a person is really triggered to that extent and experiencing extreme levels of anxiety.
And what I think about when differentiating borderline from bipolar is that people with borderline are often triggered by external triggers, whereas bipolar is an internal trigger.
Absolutely. Thank you. And thank you for adding that. I wanted to make it clear about moods because that's the most apparent to a person who may not be educated in the field, that, if you see someone who's having mood swings in one day, just shift, that's not bipolar.
Dr. Buxani, since you wanted to be interactive, there are two questions that are kind of pertinent to what you're sharing in this slide. So I'm going to read the first one. So in BPD, does the person usually feel a fear of abandonment, or could they just be angry, reactive, very emotional when thinking someone else is missing, walking out on, or leaving them?
Yes. So thank you for bringing that up. No, a person with borderline does not really have an understanding necessarily that, oh, this is what's going on. Because of my experiences, genetics, a combination of both, have this extreme fear of abandonment, and that's why I'm feeling this way, right? For them, they feel you are doing wrong because, look, I'm doing this, but you're walking away. So, they don't have an understanding it's necessarily coming from their own fear of abandonment, real or perceived, right? They really tend to think that it is the other person's behavior.
And then the other question that's also related to symptoms, how early can someone start experiencing the symptoms? My daughter is 14 and she believes she has BPD. I agree, but I haven't told her because I don't know how telling her will affect
her. It's hard because I know that we usually see it, so traditionally, we don't diagnose BPD in teenagers necessarily. However, I have teens who have BPD, and I feel to a certain extent, they're almost more accepting of it. And that's why they are ready to do the work. So the teens who I have who struggle with BPD are actually, they make strides much quicker because they have an acceptance. The other client that I was talking about, she's, that I gave you an example that I'm working with a family, she's in her 50s. I think it was a year and a half before I could even tell her because she was not ready, right? So I think teens are a little more accepting, and so they tend to do the work. I would say if you are concerned, let her see a mental health therapist, but somebody who obviously has experience with personality disorders, because not all therapists have experience with personality disorders. So, make sure you find somebody who has worked with personality disorders, and let her see without any biases. Let her just go see the therapist. And if it is BPD, the therapist should be able to catch it. All right. And I wanted to put this in because I know that we, when we spoke to Rosa, we said, okay, is this who's the audience of this presentation? And it was not only, it was going to be some therapists, but it was really general audience, and that's why I wanted, because it is really difficult to live with someone with a personality disorder. So I really I want to put it out there that please be compassionate with yourself when you are, if you know that your partner or someone who you're living with, your child, or a parent has a personality disorder, especially if it's narcissistic. I know we're not talking about that today, but that's another difficult one to deal with. And BPD, histrionic. Be compassionate with yourself. It is difficult to live with someone who has BPD. Try to be as consistent and predictable as possible, because that's one of their triggers, the inconsistency. Because if you, like for instance, if you are running late, call them up, let them know, because otherwise they might sense, or they might, that fear or the anxiety may creep in. So just be consistent and predictable to them in the relationship. Of course, seek, encourage them to seek out treatment gently. And please seek out therapy for yourself. It's extremely important that you get the support, not only in dealing with, but also in really getting more of an understanding and getting some tools for yourself to deal with a person with BPD. Managing expectations. And I think this is extremely important and it's heartbreaking. I kid you not, when people walk in and if I have a client who has a partner with BPD, and you really want things to change, you really want them to see things differently, and months go by and it doesn't, right? So just understand that this is the therapy for a person with borderline personality is a journey. It's not a destination. They are probably going to want to be in therapy for a really long time, if not lifelong. And consistently keep getting those tools, consistently keep working on those identity crises, and primarily on loving and accepting themselves, which is really hard for them to do. So manage your expectations of what this person is actually going to be able to achieve, even with therapy, and how long this process might be for them. Educate yourself. Like if you're attending something like this today, read up on it. There are some really, really amazing psychologists who have dedicated their lives to working with and understanding personality disorders. Try to understand it as much as possible for yourself. And most importantly, do not tolerate abuse, because you tolerating abuse is enabling the person with a personality disorder, right? Because they're not going to know that it's not okay. So it's very important for people who live with people with personality disorders not to tolerate and to have very, very strict boundaries around their relationships, what is okay, what is not okay. Right? What are the treatments? As we know, dialectic behavior therapy, I'm sure, not. So Marsha Linehan is the founder. She developed dialectical behavior therapy, and the reason is that she actually struggles with borderline herself. I think it's an excellent treatment, but it's a very skill-based treatment, right? So I think it's excellent to give you tools of mindfulness, emotional dysregulation, distress tolerance, like just, what can I do in the moment that I feel that way, right? Like, but I think that coupled with then some trauma-focused therapy, which, your inner child work, really loving yourself, understanding yourself, that's extremely important. And of course, we have mood stabilizers as medication if needed. All right. That's us. Always know that there is help available. So, never shy away from seeking help. You don't need to do this by yourself. You don't need to understand this by yourself. We are still understanding this, and we are in the field. It's complex. I think mental health in general is complex because you're dealing with human beings. It's not a formula. It's not an exact science. So, but just know that you have partners. You can partner and you can get support to help you through your journey.
So thank you so much for this. Was so educational, right? And I know everyone that's here tonight has heard at some point a myth about borderline personality disorder, or have seen a movie that kind of portrays this in a way that is not accurate, and that it helps to kind of keep this stigma alive around mental health conditions. And we also always like to bring back that, here at NAMI, and this is one of the most important work that we do, it's to make sure that we know that there are treatments and help and hope, and that you can have a mental health condition such as borderline personality disorder and achieve anything you want in life. But the more that you understand what those treatments are, and that we're all different, and what might work for me might not work for someone else, understanding those maybe symptoms or all that information that kind of make you seek help or seek support can help you through this journey. And we asked some of the questions while you were doing this presentation, but we have a couple more, so I wanted to kind of go into those questions. So we had a question that is there a more common attachment style for those with BPD in relationship? Anxious, avoidant, or disorganized?
Anxious. So we do see people with BPD having a very anxious attachment style. And again, it makes sense, right? Because, and that's really the emotion that we see the most amongst borderlines. We see them struggling with anxiety because it's, that fear of, oh my gosh, I'm going to lose this person. Oh my gosh, what are they going to think about me? They're going to leave me. They're going to, so we do see a lot of people with borderline having an anxious attachment.
Okay, so we have another question too. Let me get to that one. Can you repeat the name of the person that wrote the book on BPT regarding to borderline personality?
I'm guessing it was the 4 types.
No, I'm sorry. You mentioned someone very famous, and I had heard her name before that
yes.
had DBT. Had borderline, sorry, and I
Yes.
think she was a psychiatrist as well, but I had
Yes.
heard her name before and I forgot her.
So her name is Marsha Linehan. And she actually developed dialectical behavior therapy. Thereon, we've had other people who've twisted and turned and also have different versions of dialectical behavior therapy, but she was really the founder of DBT as a treatment form for people with borderline personality disorder. Some of my other favorites, I mean, I love some of the work that Theodore Millon has done in understanding personality disorders. And then there is one of my personal favorites is Dr. Ramani. She, she's a psychologist from California, done a lot of work also with personality disorders. And she has a lot of her podcasts around. So there's a few people, that and there's more than that. But these are a few names for you to start with. But yes, DBT as a technique was developed by Marsha Linehan.
Thank you.
No problem.
Thank you. So there's another question also. How you differentiate narcissism from BPD? You kind of brought that those
Yeah, I have a few questions related to this topic.
Yeah.
Olivia, go ahead if you want to ask those questions too.
Yes. So one is
answer this one though, or no, or you want me to wait for the narcissist?
Yeah, I was going to ask the questions myself.
Oh, okay.
So first of all, how do we differentiate narcissism versus borderline? Are feelings of emptiness and identity disturbance the main differentiating traits? That's my first question.
Yes, and you see, other than the impulsive BPD, generally people with borderline personality will have a sense of empathy. They're not devoid of empathy. A narcissist really finds they really don't have empathy. It's that extreme lack of empathy. But those two disorders are sisters. And I was explaining to Rosa before we hopped on that they sometimes it's like pulling hair because they share so many traits. But I think one of the things that really sets them apart is that extreme lack of empathy that we see in a narcissist. That borderlines we'll still see, and the other thing is a borderline really wants the relationship. A narcissist couldn't care less, right? Like with a borderline, they don't want to lose you. They don't want to lose the relationship. They're trying to hold on. For a narcissist, the relationship is a means to an end, and really the end is about themselves. So they're not necessarily going to go after you or plead with you to be in their lives. I hope that's a little helpful.
Thank you very much. Yes, it is. And then the other question I have, are borderline and narcissistic rage usually more similar than different? How do we differentiate borderline rage from narcissistic rage?
They do look similar. We don't experience a lot of narcissistic rage because they don't come in. We don't see narcissists coming into therapy because they're too, it's hard to get a narcissist to come in. The only time we see them is if it's in a couple situation, and the wife has said, no, you need to come, and then they come in and say, okay, fix her. That's when you see the narcissist. But yes, I think in terms of rage, they are similar because you'll see almost like a switch like flip and all of a sudden it's like, oh my gosh, what happened here? And it's scary sometimes to see that.
Thank you very much. One other question I have is related to splitting. Whereas a narcissist will just be mean and vindictive and completely not care. Can a borderline can someone with borderline hold on to the rage and hatred towards another person
Yes.
for very long periods of time, like a narcissist? Can they hold on to that for years?
No, I think, and that's different for both of them. So a borderline can hold on to it, but not as long as a narcissist will, right? At some point, they will come around because, like I said, they do have some level of empathy, and plus, their identities are so built in to their relationships that they really don't want. I mean, they fear losing relationships, so they're not going to necessarily hold on to it. They might. I've seen some of my borderline patients hold on to it maybe like for a week, 2 weeks, 3 weeks, and then and and then it's funny because then they go back to being as normal as like, oh, nothing happened, like, get over it. But then in the process they've hurt the other person. So I absolutely believe they're different over there. A narcissist, while can hold on for years, because for a narcissist, their thought process is, you did wrong, I'm going to punish you, and your punishment is going to be my silent treatment. So you don't exist for me, but that's a form of punishment. Borderlines don't think that way. They don't go about trying to punish. What they just act out of such a deep feeling of anxiety and hurt themselves, that they almost feel like, okay, I'm going to give you space, but that space is not because I'm punishing you. The space is either because I feel I'm a terrible person. So, like how we talked about the quiet, discouraged ones, where they really, self-loathe, or like, oh my gosh, how did I do this? I can't show my face anymore to somebody. So they will create the distance because of that. Versus, like I said, a narcissist, it's more like, oh, how dare you? How dare you do that? Now wait, I'm going to punish you for this. I don't know if
And
that.
so, yes, very
Yeah.
helpful. And so, if someone is in like a roller coaster relationship of hatred and love, um, with someone being rageful, angry, mean, and then later on apologizing, calming down, saying, I love you, I care about you, don't leave. Um, that sounds a lot like borderline, but a narcissist could also
Yes,
probably present that way, being
absolutely.
manipulative in order to get what they
Absolutely.
want.
Absolutely. 100%. In fact, when you were saying that, that sounded more like a narcissist than somebody with BPD, because, I rarely, especially with my clients with BPD, I rarely see them consistently do that, right? Like, they really have to get triggered to, oh my gosh, you're going to leave me? No, then wait, I'm going to do something about it. Versus for a narcissist, it's about meeting their needs. How can I get this person to meet my needs? So their cycle of abuse is really, more apparent. And what you were talking about, Olivia, sounds like to me more narcissistic.
Thank you, Dr.
Thank
Buxani.
you.
Now it's 7.
Don't
Thank you,
worry.
Olivia, for your question.
Olivia, email me. I'll answer you more questions if you need.
It's
Thank you
7.
so much.
Thank you, Olivia. 7:32, and we have one more question, so I want to get to that one. Do you
Sure.
feel enthusiastic about someone with borderline personality being able to maintain a long-term job with therapy, or is this ultimately very difficult for them?
No. A job, absolutely, 100% they can maintain. They can even maintain relationships just as long as, I think the biggest thing is that acceptance of, okay, this is what's happening. Because I feel like something clicks almost within a person once they get that acceptance. Because then when I'm reacting, I can actually take a step back and say, okay, hold on, where's this chaos coming from? Is this really from this situation? And I have seen borderlines go on to have successful relationships and definitely successful work situations, as long as they commit to, working on themselves.
Thank you, Dr. Buxani. I think that's the best way to end this Ask the Expert, because we know that if you do, find support and help, and make sure that you seek treatment if needed, whatever that treatment is, you can live a very meaningful and successful life. And that's something that's very important for us to always
Absolutely.
share when we talk
Absolutely.
about, mental health conditions and mental health struggles. So thank you so much, everyone. Thank you for joining us and taking your time to be here with us. And any questions, you can reach out to us at any time or work line. My email, rosa@namiamiami.org, and you have Dr. Buxani's contact as well. Thank you so much. Have a great night.
Thank you.